I'm Kyle Hall. It is the 10th of April, and this is my anatomical terminology homework. We'll start with the frontal plane, which is a cross section that divides the body into the anterior and posterior planes. Anterior pertains to things going forward, and posterior pertains to things going behind. For example, the rib cage is anterior to the spinal cord. The occipital bone in the skull is posterior to the frontal bone. Next, we have the transverse plane, which is a cross section horizontally. This separates the body superior and inferior. Superior pertains to things in the sequence that are going up towards the brain or towards the cranium. The inferior pertains to things in the sequence that are going away from the head. For example, the head is superior to the shoulders, whereas the small intestines are inferior to the stomach. Next, we have the sagittal plane, which is a vertical line right down the middle called the sagittal midline. Here we have medial, which pertains to things in the sequence going in towards that midline. Lateral pertains to things going away from the midline. For example, the sternum is medial to the shoulders, whereas the lungs are lateral to the heart. Next, we have proximal and distal, which refer to the point of attachment. For example, the shoulder is proximal to the elbow because it is closer to the point of attachment, whereas distal, meaning further from the attachment, refers to the wrist being distal to the elbow. Next, we have the superficial and deep. Superficial is closer to the surface of the skin, and deep is more inside the body. For example, if you're looking at the layers of the skin, the epidermis is superficial to the dermis. However, the hypodermis is deep to the dermis. Thank you.